West Africa is predicted to be one of the areas that is most affected by extreme heat going forward. So we've been looking initially at the exposure of extreme heat for pregnant subsistence farmers and how that impacts on the mothers and then also on the babies acutely while still in the womb. Although we know that that the heat is a risk factor, we don't really yet understand what it is about the heat that is causing these problems. So is it, related to the women getting hotter themselves? Is it related to dehydration? Is there some sort of other pathways that are maybe involved in it? And why this is important is that if we then want to go on to give any advice or any adaptations or interventions, we want it to be based on the evidence. So we identified pregnant women through the antenatal clinics in a rural subsistence area. And then once they were consented and agreed to be part of the study, we would then follow them out into the field to understand what sort of exposures they were getting on a normal working day for them. We were very surprised to find the amount of heat exposure in our women. For at least 30% of the time, the pregnant farmers were being exposed to high levels of heat stress, and up to 60% of the women had a symptom related to heat. So that's from dizziness to nausea to vomiting. They're quite non-specific symptoms. And so we were quite shocked to find that in 33% of field visits, there was evidence of acute fetal strain, so that the sort of heat strain from the mother was being passed on to the baby. Before this work was done, there wasn't such an awareness around the potential dangers of heat. And particularly, there wasn't, subsistence farmers are often missing from the literature. And it's not just subsistence farmers that are at risk, because in these settings, everybody is exposed. And in fact, there's not really sort of cooling options that you get in other situations. By highlighting the problem, we hope that this will then put pregnant women on the agenda when it comes to adaptations and identify them really as an at-risk group going forward.